Welcome to Fix SLP, the podcast shaking up the field of speech-language pathology. We're calling out the barriers that hold clinicians back, fixing broken systems that limit our care, and giving the power of our profession back to the people who live it every day. This is where fearless clinicians come together. It's time to change the field with our voices, leadership, and advocacy leading the way.
So let's fix SLP.
Hey everybody, welcome to episode 100, season 3, episode 100. Here we go. We've got a new intro. We've got a new thumbnail on your streamer. We someday are going to have a new website. We don't have it for you today. We've got new branding. We freshened up our colors. We still have Preston, but he's not here today. Today, I've got Katie Brown from NeuroSpeech Solutions. Our 100th episode was supposed to be a celebration. It was a look back. I had audio problems. And then every time we tried to come together, since me trying to edit, we've had issues. And so we're late this week to a podcast. So we kind of hung out to see what was going to happen with Medicare, and Katie agreed last minute to come on and do this with me. So I've got Katie Brown celebrating our 100th episode. Who knew you were going to have this honor?
I know. I am truly honored to be the de facto 100th episode podcast guest.
I feel like you need a t-shirt. We might make that happen.
I want
it. Speaking of t-shirts, I wasn't going to say this, but every fall we do t-shirts. And I think this year we were going to kind of open it up to our fixers to send us some designs. And if we choose your design, we'll give you a free shirt. So send those in. team@fixslp.com. Send us some ideas. Tell us what you want to see. I have not planned this at all, and I'm going to be really sorry. I might even edit this out, but we'll see. What I am supposed to say is, not a one of us is going to ASHA in Washington, D.C., but we did decide to go to Washington, D.C. Nearly all of our team will be there, and we are hosting a party on Friday, November 21st, from 7 to 9 p.m. We have rented out a bar, a small intimate bar, so tickets are limited, but we will be selling tickets. Watch our socials for that. There will be an early bird price. I'm not going to say it because I have to go over the final stuff, but we'll have some snacks. We'll have our bodies there, me, Michaela, Elizabeth for sure. If you all pressure Preston, maybe him, Alexa can't make it, but we'll be there to visit with you. We have a DJ, but not a dance floor because we just want it to be intimate and a place where we can gather, get to know our fixers, let you get to know us, and just have some drinks and snacks and a good time. We might even have some vendors.
Sounds great.
I booked the place, so we have to start selling tickets. The rest of the details are going to come together pretty quick here. So here we are. Katie, thanks again for coming on.
Yeah, of course.
You and I announced today, this morning, October 1st, that as of right now, as of this recording, the Medicare telehealth coverage for traditional Medicare beneficiaries has expired. And it hasn't just expired for us. It's PT, OT, dietitians, a lot of practitioners are now being held to the previous standard from before COVID-19, right?
Correct. Yes.
Katie, do you just want to start by telling us why this wasn't extended? What happened?
Unfortunately, the government shutdown is the thing that caused telehealth to not be extended. So essentially, we knew that telehealth was extended through September 30th. And what needed to happen was Congress needed to come together, come to an agreement, and extend telehealth among many other things. Telehealth is unfortunately tied to the budget bill that our congressional leaders could not decide on. And since they did not make a decision on that, that meant that our extension to provide telehealth services for Medicare beneficiaries lapsed. So it's not that we were just denied, it's that they didn't make a decision, so the extension ended. So we have to move forward with not providing telehealth services right now.
Right. And it's not even, there just wasn't a vote. I've seen people say that, well, the government shut down. Wouldn't we be under the same rules? That answer is no. There was a hard expiration date. That was September 30th. So we woke up today to the government shut down. And that doesn't mean no, they're just extending. No, because there was a hard expiration date on there. That was it.
Yes.
So no, somebody said, well, I haven't seen anything posted. And, our friends over at ASHA, I've been looking all day. Nothing. I mean, can we expect anything more out of them? No. So just because they haven't said anything to this point, I'm sure they eventually will, doesn't mean that we can do it. So it doesn't mean we can't provide the service. It just means Medicare, as of right now, won't cover it. And we'll get into some of that. So we posted this morning and stuff has been coming in all day to the point where I didn't even post our planned evening post today because people were still paying attention to our post from this morning. And one of the questions I've seen over and over again is, does this affect the schools? What about Medicaid? What about managed care plans? So, Katie, we've been trying to answer those questions, but in case people didn't see it, who does this impact right now today?
So right now today, this immediately impacts anyone who has traditional Medicare Part B. So services provided by SLPs, as well as Jeanette said, PTs, OTs, dietitians, a whole slew of other healthcare professionals. We are not going to be able to provide covered Medicare services, telehealth for those individuals. So this does not include individuals who have a Medicare Advantage plan through another commercial insurance. So that is an important distinction. It also does not include Medicaid right now. So Medicare is a federal program. Medicaid are state-based programs. So it is only the federal programs that are being impacted right now.
I've seen, does it affect the schools? Generally, that answer is no. However, there are some children that receive Medicare that is based on a long-term disability. There's all kinds of things that need to happen for children to qualify. So what my advice has been in our social media today is, if you are a provider that bills for a child, just double check their payer source.
Mm-hmm.
Almost every time the answer is going to be no, but just make sure if you're worried.
A lot of people think of Medicare as just elderly, but there are a lot of people under the age of 65 who receive Medicare benefits.
What about Part A patients in a nursing home? Do we know? So the reason I'm asking this is because I am currently serving a very underserved skilled nursing facility 2 hours from my house. They have not had a full-time SLP since April. And so I am always the company's last resort because I make them pay me my PRN rate from the moment my big toe exits the door till my big toe goes back in my front door, plus mileage. So they are paying me 4 hours of drive time plus the mileage. They cannot afford to bring me out more than 1 day a week, which I totally understand. They're losing money every time I put on my scrubs. And what I told the director of rehab was, let's wait and see what happens, because I have provided telehealth for a building up in Michigan. I'm down in Ohio. We can do it again. The company will send me a laptop, get me on their remote server. I've done this with them before. We can do it again, but let's wait and see what happens. So this does also include Part A. I've looked it up. And so the rollback that we experienced as of this morning mostly applies to Part B. For Part A in a skilled nursing facility, a SNF can technically choose to deliver therapy via telehealth. CMS has said telehealth is not a recognized substitute for required in-person care under Part A. So, like, in practice, SNFs could use it as a tool, but it would be at their own risk. And my offer to them was I would still need to come in person, but then let's try this via telehealth 1 or 2 more days a week, because then they could get more services. Plus, then maybe you could get another PRN to come in, which they've been occasionally able to do. I just said, let's wait and see. So for me, from what I've seen online, if I were to provide services to these Part A patients, because of the expiration, Medicare still would not officially recognize the encounter as covered under Part A, even though it's a bundled payment. So it was already kind of like at your own risk, but now it's, yeah, you can't do that. It removes the safe harbor that was put into place during the pandemic. So no, it's mostly Part B, but you shouldn't be doing it for Part A either, unfortunately. So that stinks, because this becomes an access to care issue. This is Amish country I'm driving to. Amish country in Ohio, in the middle of nowhere. I don't have a cell phone signal in that building. These people are already struggling for access, right? And now we had this great solution, because we all know me going there 1 day a week is helping almost no one. I'm not making them better. I've been getting 25 minutes with some of these Part B people. 25 minutes once a week is not fixing any problems. It's managing crisis after crisis, really, is what it is. So it was a good solution. Hopefully this gets fixed. So we'll talk about that.
Yeah, the other big question is this permanent or is this temporary? Right. And the answer is who knows?
Right. So what are the options? Well, we wait to see what options do these patients and providers have, because we've put it out there and I've seen the question that we're going to address now asked a couple of times. So give us the options and I will pose the question that we've seen all day.
Here are the following options that you have. You can cancel all of the telehealth appointments, right? You could potentially say, let's try for a few weeks. So let's try and see you in a few weeks if this does end up getting extended. You can see the patient in person. If they are in person, Medicare will pay for the service. The other option is if the patient truly cannot come in person and wants their therapy, the option is going to be to pay privately for services after issuing an advanced beneficiary notice, which is an ABN, which is a CMS specific document.
But Katie, we can't take cash from Medicare recipients. We can't do private pay with people 65 and older. Why could we do it now? We've seen that question all day. So do you want to explain that?
That is the number one question, yes. Everyone has been terrified of accepting private payment from any individual who is Medicare age, but it's actually not that we can't take cash at all. It's that we can't accept cash for a Medicare covered service. So since Medicare is no longer covering telehealth, that now becomes eligible for cash private payment.
Yep. So you just issue that ABN. We will get that linked up in our show notes if people want to access that. However, if Medicare reinstates the extension and goes retro, or makes it permanent and goes retro, we will then have to issue a refund and submit the claim. So don't take this right now as your opportunity to all of a sudden start taking cash if you don't have an NPI number, if you're not credentialed with Medicare, because you'll have to give them their money back and you won't have a way to submit a claim. So this is a wait and see thing. If this isn't renewed or made permanent, you could be out of time and money. So just wait and see where this goes. And then if you want to open your cash telehealth practice, if it's not covered anymore, do that in a month or two, but don't do it tomorrow.
No, do not.
Yeah. So this doesn't apply to people with these managed care plans or other payers. I've seen a lot of people say, my employer isn't allowing me to provide any telehealth services. And to me, that's just laziness because they don't want to check the payer source.
Yeah, that's an abundance of caution.
Yeah.
And then just blanket statement saying we're not going to do telehealth because we don't want to get in trouble.
Yeah.
Which is problematic.
And I think you could very easily be advocating by looking at their chart to see who their payers are and then providing the information from Medicare to your employer, because now we're making this access to care issue even worse for people that actually do have the coverage that are being punished because somebody doesn't want to check paperwork. Now, if this is not made permanent, there could be a trickle-down effect, right?
That's what I anticipate.
Yeah. It starts with Medicare. Everybody follows Medicare. So for sure, the managed care plans would eventually follow suit. And it would be one by one. It's not like all of a sudden no managed care plans would do it. Each managed care plan would make that decision on their own and then notify providers. Medicaid will probably then eventually follow, and then it could eventually be applied to children on Medicaid or private insurers. We don't know. Prior to the pandemic, there were some insurers covering telehealth for children. We don't know the extent of that because neither of us have worked with children in that capacity, but it was happening because there were people hiring for that job.
Yeah.
Or maybe they were all just private pay, but that it was happening before. But generally speaking, there would likely be a trickle down effect eventually. So we don't know. This is up in the air. Why don't you tell us about some of the repercussions of the shutdown in general? I know that they put out some clarifications today about billing and claims. So why don't you tell us a little bit about that? Because we both had information in our stories that I think could have confused some people. So do you want to explain what all of that said?
Sure. So CMS did come out and make a statement addressing the government shutdown and did, in fact, say the telehealth extension has ended. We cannot process telehealth claims by providers who were temporary telehealth providers by Medicare. So that was confirmed by CMS that we're not able to do that. Another thing that they mentioned was that they are pausing claim processing for services. So as the government is shut down, they're not going to be paying federal workers to process Medicare claims. So right now they estimate it at being a 10 business day shutdown for claim processing. In the meantime, you can submit claims if you would like to. However, none of those claims will be processed for, they're estimating 10 business days. Could be shorter, could be longer. So again, that's just causing a delay now in reimbursement for individuals who need it, for the providers that need it as well, for the services that they're providing, over these next several weeks.
Yeah. So, shocker, they're not processing anything, but those are separate things. So the thing one was, yes, they confirmed there was a rollback to pre-pandemic services. You cannot bill for telehealth. That does not mean submit the claim and then there's a 10-day hold and let's see what happens. It means you cannot submit that claim at all. And so then the 10-day hold and the lack of processing is going to apply to those in-person still covered services.
Yeah.
So those were two different things that when I read it quickly at a red light in the car, I was like, oh, can my company still submit the claim? And then we see what happens in 10 days. No, I read it again later. If for telehealth, claims cannot even be submitted.
Yes, good distinction. Sometimes these things make sense in my head, but need to be spelled out for sure. Yes, so all Medicare claims are being held. It's not exclusive to the telehealth.
Now it's a wait and see thing. We don't know. You and I have no insider information to when the government is going to open back up. We have no insider information to if they will come to some kind of agreement. We don't know. What we do know is Medicare did say, go ahead and give those ABNs if people still want services, just explaining that Medicare won't pay. If they still want service, they'll be responsible for the cost. They could. It doesn't, I don't even think it says on the ABN, you could be issued a refund. That's not on there. I wouldn't put it in writing either, but you could tell them verbally if they vote this through and make it permanent or renew the temporary allowance, then you would get a refund, but there's no promises there. So they did say you can do that, right? In their notification.
They said issue an ABN.
Yeah. And then this becomes what we keep saying. This is an access to care issue. This is for the people who have the means to pay for this out of pocket, right? What about the people who don't have the means to pay for this out of pocket? They're just out of luck. Unless their provider can get to their home for outpatient Part B in person. But a lot of times that's not going to happen.
No. Unfortunately, I've had to cancel a lot of appointments between today and, tomorrow, Thursday, and Friday. So right now, what my clinic has done is we have canceled all telehealth appointments or tried to convert them to in-person, but I do see individuals across the state who live hours from me, so they can't reasonably come in person. So we've had to cancel those appointments. We have essentially put them on a hold and let them know we will update you as soon as we get updates.
And it's, just to really put this into perspective, there are hospice patients who literally can't leave their house, and now they have to have recertifications face to face. I have no words for that. That's not a speech thing, but I mean, this goes wide. It's not just speech. There is a wide impact here for many people with many medical issues that, yeah, okay, well, what did we do before the pandemic? Well, we had systems in place. That was 5.5 years ago. Oh my gosh, can you believe it was 5.5 years ago, right?
It was.
Oh my God, I was living a different life back then.
I
I'm a
know.
different person. How did that go so fast? Anyway, we had different systems in place. Companies were hiring in a different way for different jobs. Whole companies have opened up to provide these kinds of services. 5.5 years, you guys, is more than a half of a decade. I mean, let's put that into perspective. We can't just say go back to pre-pandemic times. More systems have been developed to support people with needs.
Mm-hmm.
This is crazy. And we keep like politics and stuff out of our platform, but I wrote it earlier and I took it off because we don't generally make statements like this, but the only people who win here is the government. And that's not left, right, up, down, middle, crossroad, whatever. Nobody wins except the people making the budget. That's it. And that's from all sides of party lines, right? Like, this isn't an attack on either side. It's just the only people who win here are the people making the budget, and that is the government. They're saving money. And that's disgusting. A lot of things they do are disgusting, but this tops it for me.
Not being able to provide telehealth services in the year 2025 is just not an acceptable response at this point.
Right. And I said in that thing that I deleted, I think I kept that this not only impacts the people we serve, because that's important, but it also impacts our jobs. There are people who have telehealth only jobs who were out of a job as of this morning when they woke up. Not just speech therapists. Like I said, there are many people who have been providing telehealth therapy only for some time, and they just don't have jobs today. So it's impacting care, but it's also impacting the economics of our society. So this is big. This is a problem. So Katie, we don't know what's going to happen. We don't have answers. What we can say is we're going to keep watching this. And by we, I mean you. You guys, Katie is not on the Fix SLP team, but she's the perfect example of a clinician who has identified a problem, taken it on herself, come to us and said, this is what I'm doing. Do you want to collaborate on this? We did our little due diligence, right? We looked her up to make sure she was only half crazy. And then you can't see her. She did a little smile. You know, once we saw, okay, she seems legit. Yeah, we'll collaborate. You know, then we've been putting out stuff from her. This is going to be our, today's post was our third collaboration. This is the second time on the podcast, right?
No, yes, I've been on your podcast twice now.
Yeah, okay. I didn't know if it was 2 times already. So this is, yeah, second time in a month. You're hired with all the Monopoly dollars that I paid the rest of the team. Do you want the pink or the blue? It's up to you.
I'll take the blue.
Perfect. It's in the mail. So she's just that perfect example of she saw a problem that needed fixed. She has taken it on and she is letting us know, like, hey, this is happening. Do we want to post? And so we'll do that with you. She's not the only one. We'll do that with whoever, because we can't do it all. We can't do everything. It's going to take all of us doing our part to fix the things that need to be addressed in this field. So Katie is going to keep watching. I will keep a general eye on it because my folks in Amish country need service.
They do.
And I have the time to service them from my basement. I just don't have 4 hours a day to get out there. And the company, they don't have the money. We'll keep watching our content. What can people do in the meantime, Katie? How do we take action? If people want to do something, what can they do?
First recommendation is going to be to call your representatives. Call your representatives. If you haven't downloaded my Telehealth Advocacy Toolkit, which I know Jeanette has posted on the Fix SLP website, it's also on my website as well. You can download that. It'll tell you exactly how you can find your Congress representatives. Give them a call. Let them know that this shutdown has very far-reaching effects and that our patients need access to care.
Yeah, it is linked up at the top of fixslp.com. We will also put it in the show notes. I will also link Katie's last podcast in the show notes, so you can give that a listen if you're interested. And we'll just keep adding resources. If there's things that you can do, we'll just link it all there. But as of right now, it's just a wait and see. Let your patients know, provide the service if they're willing to pay, call your reps, and fingers crossed that this gets worked out and gets worked out quickly. But be prepared because they might keep dragging their feet. Anything else on this topic?
We're good.
There's one more thing I want to do before we go. We did the On Our Way to 100K downloads contest starting, 3 months ago. We hit it before our 100th episode. We hit it before our 2-year anniversary. And we had contests all the way through, plus a bingo card that people could do that was in line with all of the contests, plus some extra stuff. We pulled a name. I haven't announced it yet, so nobody has been notified, but I want to congratulate Sarah, who has won 1 year of continuing education from Speech Therapy PD. They donated that to us. She's got a 1-year subscription, so she can do 100 hours. She can do 1 hour. She can do whatever she wants with it. Sarah, if you're listening, you don't have to contact us. I know who you are from your bingo card entry, and I will get in contact with you. So congratulations to Sarah. Thank you everyone who supported us over the summer through our summer school series and who took part in sharing their episodes or rating and reviewing us. You guys are awesome. So here's to year 3. Here's to season 3. Here's to Katie, who's the winner. She's the winner. She got to be the guest. So, Katie, thanks for coming on last minute. We really appreciate you. And you guys will just keep you posted. So, if that's it, I'll say thanks for fixing it. We'll see you next week. Thanks for listening to the Fix SLP podcast, the podcast shaking up the field of speech-language pathology. Don't forget to check out our social media or fixslp.com for our latest promo codes for continuing education, therapy materials, merch, and more. Supporting our sponsors also supports our Fix SLP team. Don't just listen, be a part of the change. Share this episode and our social media content, and let's keep fixing the field one fight at a time.